It is now my pleasure to introduce this evening's keynote speaker, Roberto Muñiz. Roberto is president and CEO of the Parker Health Group, a not-for-profit, best-in-class healthcare and aging services organization in New Jersey. In his role for nearly 25 years, Roberto has grown the organization from 2 small nursing homes to a full continuum of aging services, providing residential and community-based support to thousands of seniors. Under his leadership, Parker partnered with the VNA Health Group to launch Parker Advanced Care Institute, providing seniors living at home with access to visiting physician and palliative care services. Last year, Parker made a generous gift to create the Parker Health Group Division of Geriatrics in the Department of Family Medicine and Community Health at the medical school, greatly improving care for seniors. Roberto also currently serves as the board chair for Leading Age, a national organization representing more than 5,000 not-for-profit providers of aging services. He's a proud alum of Rutgers with a bachelor's degree in public health administration and a master's degree in public administration, both from Rutgers. He's also an adjunct instructor in our Department of Family Medicine and Community Health and a senior health fellow at the Edward J. Blaustein School. Please join me in welcoming Roberto Muñiz.
Set of eyes in here. Thank you so much, Dean Murtha. Esteemed families, faculties, parents, and distinguished guests. But most importantly, the extraordinary 2024 graduating class of Rutgers Robert Wood Johnson Medical School. Congratulations. It's an honor for me to be with all of you tonight. And now you're probably asking, what the heck is a long-term care executive doing at a convocation like this one? Well, that's a very good question. When I'm about to speak on stage, very often there's a brief moment of panic, and I ask the same question: what in the hell am I doing here? Well, let me tell you why I'm here tonight. I was invited to speak with all of you tonight because Taylor Swift was already booked. Let me tell you the real reason why I'm here tonight. I'm here tonight to share a story with you about 3 very special and caring healthcare professionals who changed my life. And my hope is that someday, when the moment strikes, you will remember my story and you will choose to take action. For me, it has been a journey. You see, when I was a young boy, I never thought that I would amount to anything. My early life was spent feeling like I had no future. And then in high school, my guidance counselor confirmed that when she told me, "Roberto, you are not college material." I was born and raised in Puerto Rico, in a small town up in the mountains. Thank you. My parents have 14 children. Yes, 14 children. 7 boys and 7 girls. When I was a teenager, my parents separated, and my mom brought us to live in Elizabeth, New Jersey. We lived in a 2-bedroom apartment in a run-down and drug-infested part of the town. I remember every other weekend, there was a shooting or a stabbing at the neighborhood bars right next door to us. We were welfare kids. Many nights, the only thing we had to eat was 2 slices of bread with mayonnaise. I hate mayonnaise right now. And to make matters worse, my mom was always sick. As the youngest of the boys, it was my job to take my mom to the Alexian Brothers Hospital in Elizabeth for doctor's appointments, x-rays, and lab work. We were there so often that the staff at the hospital began to recognize us. One of the pharmacists who worked there was a very kind Cuban woman named Balbina. And whenever I passed by the pharmacy counter, she would always say hello to me. I didn't speak English well, so she would talk to me in Spanish, and I loved her for that. One day, Balbina suggested that I become a volunteer at the hospital. I was very excited. Right away, I asked her, do volunteers get paid? She says, no, Roberto, volunteers do not get paid, but if you work 4 hours, you get a free meal. That sounded great to me. Eating my meals at the hospital meant that my family at home would be able to eat additional food, and that my family could stretch the food that we had a little bit longer. I signed up immediately, and every day after school, I went straight to the hospital. I spent as many hours as I could volunteering there. The hospital became a sanctuary for me. It was a place where I could feel safe, and where I could escape away from that horrible environment and that small apartment that I lived in. The volunteer coordinator's name was Teresa, and she took a great interest in me. She even helped me land my first paying job, and I became a stock boy at the pharmacy. Wow, that was great. Working every other weekend. It was there that I met another pharmacist. His name was Ben. He was 80 years old. As a young boy, it was amazing for me to watch this man at his age, mixing medications, working in a hospital, and leading such an active life. His capabilities left a lasting impression in me. One day, Teresa and Ben asked me what I wanted to do with my life. I trusted them, so I told them that my guidance counselor had told me that I was not college material, and that 3 of my siblings were working at a local factory not far from the hospital, and most likely I would be joining them. That's when Teresa told me, no, Roberto, you're going to college. And Rutgers is having an open house in a couple of weeks, and I will take you there. Sure enough, she drove me to the open house. Teresa and Ben helped me to fill out my college application and my financial aid forms. And Ben even paid for my application fees. And guess what? I got accepted. During the week, I would go to college, and on weekends, I would work 40 hours at the hospital as a nurse's aide. I remember to get back and forth from school to the hospital, I had an old Chevy Nova. And for those of you who don't speak Spanish, Nova means no go. I got to tell you, that's exactly the perfect description of my first car. It was broken all the time. At the hospital, I worked 16-hour shift every weekend. During my break, the nurse manager, feeling sorry for me, would allow me to take a nap in the linen carts. I know, definitely not a good infection control practice. She would cover the car with a white sheet so that no one would see me sleeping there. In the mornings, I would get up and do my AM care and start the routine all over again. And by the way, if you haven't found yourself sleeping in a linen car yet, don't worry. You may get your chance during your residency. After graduating college, I continued to work in hospitals. Eventually, I landed a job as an assistant administrator at a county hospital for long-term care and psychiatric patients. I loved that work. But this was a horrible, rundown facility. I felt so terrible because these seniors deserve far better care and treatment than what they were receiving. I knew we could do much better than that. And that's when my passion for serving seniors was ignited. I was going to spend the rest of my life helping other adults. I'm not sure exactly where the time has gone, but as Dean Murtha mentioned earlier, last year I proudly celebrated 25 years as the president and CEO of the Parker Health Group. Here's my point. My mother brought our family to the United States to have a chance at a better life. That better life would not have been possible for me without the encouragement of three very special and caring healthcare professionals. I thank God for Balbina, Teresa, and Ben, who opened doors for me, giving me opportunities. They saw potential in me. They believed in me when I did not believe in myself. Now, here's the part where you come in. After your residency and your fellowship, there will be endless possibilities for you to consider. Regardless of where your journey takes you as a physician, each of you will be a leader. You will be a respected member of both your profession and your community. You will be an influencer. And without a doubt, you will be in a position to help others. Don't forget where I was as a teenager. I was the son of a chronically ill patient who was always at the hospital and barely spoke English. I was also an at-risk youth. With my circumstances and the environment around me, I could have easily ended up just another statistic. What first set everything into motion for me was a single conversation in Spanish with a kind woman at the pharmacy counter. It took just a few minutes of Balbina's time to say hello to this skinny Puerto Rican kid. That small act of kindness changed my life forever. As doctors, you will have the power to mend broken bodies, to heal the sick, and to save lives. There's another dimension of your profession that often goes unnoticed. You will also have the power to change lives. You will meet many people throughout your career. My humble request to you is this: when an opportunity for kindness presents itself, take action. Even a small gesture can transform someone's future and have a ripple effect you cannot even imagine, as it did for me. You are the leaders of tomorrow. You will develop new medical procedures. You will launch new innovation in technology. You will make groundbreaking discoveries in medical research. You will save lives. As I stand before you on this most important day, I want you to remember that changing a life is just as meaningful and impactful as saving one. And I encourage you to go out there and do just that. On behalf of all of us, we look forward to all the incredible things you will do and all the lives you will change. Thank you and congratulations to the class of 2024.
Don't go too far away, Roberto. So first, thank you for those inspiring words. And I noticed that we were thematically linked, actually, not intentionally, but that was very nice, actually. I appreciate that. And on behalf of the Robert Wood Johnson Medical School, we'd like to present you with this engraved vase as a token of our appreciation.
Thank you.